name is Ronald English. I am a consultant trainer with the Reach West Virginia program, which is racial and ethnic approaches to community health across West Virginia. And Pastor Patterson has been a part of that movement since it began about a year ago. I've been involved in it since the beginning of this year. And recently at a conference at Glade Springs, which was our annual conference, one of the speakers reminded us that the healthcare system is broken, but it was kind of designed to be that way because of the ways in which ethnic minorities have been treated over a period of time. So consequently, the project Reach West Virginia is dealing with not only health care, but dealing with health disparities and systematically an approach to approaching health equity, because health disparities deal with the weak side. Health equity deals with the strengths. And the communities that come together to coalesce around those kinds of issues that really move toward health equity is where we want to continue to encourage. And the legislation that Pastor Watts has just identified helps us to do that. And this particular organization identifies itself as a movement, not an event, to eliminate health disparities and move toward health equity. It is a program that is part of the national program as the cornerstone of the Centers for Disease Control, and that efforts to eliminate racial and health disparities in the United States. And we work with and under the aegis of the Department of DHHR, and it is our hope, it is our quest to identify coalitions and to strengthen community coalitions to make an effort at the local level that will combine with the efforts at the national and state level. And the counties in which we are working right now are McDowell County, Mercer County, Fayette County, Raleigh County, and Kanawha County. And it is a grassroots effort to move from health disparities to health equity, involving the community in this quest for a better health system.
We passed around a list of the statistics and the data as it relates to the disparities that everyone can read. I didn't want to stand up here and read those off, but all of you can look at those, and that will give you an idea of exactly what's going on as it relates to those disparate conditions that we're talking about. And believe you, we are excited about making something happen and getting healthcare legislation reform passed, as well as getting policies in place at the state and local level that will eliminate these disparities. Now, we're so thankful for all the people that came out to support us this morning. So I'm going to ask Rick Wilson if he would just introduce and just let us know exactly who's here. I see Kenny from NAACP is here. I see Dennis from West Virginia Council of Churches, and a lot of other friends. I see our labor friends here. So I'm just asking Rick if you would just tell us everybody's name.
This is the part where you can really get in trouble. I'd like to recognize Senator Dan Foster, who's sitting in the back room. Thank you for coming out today. AARP is here. West Virginia Citizen Action Group is here. We've heard from Reach, we've heard from Hope Community Development, Grace Bible Church. The West Virginia Center on Budget and Policy is here. Partnership of African American Churches. West Virginia AFL-CIO, West Virginia Citizen Action Group, West Virginia Chapter NAACP, American Friends Service Committee. Did I leave anybody? Al.
National Association of Social Work.
Thank you so much for coming out here today. I think one thing you've heard here today is a holistic approach, and if I could sum it up in a real simple way, it would be that poverty can make you sick, but sickness can make you poor. It works both ways. And I think, holding up that and the need to work on those issues is a key message. Colonel Hale, do you have anything you'd like to say? Anyone else?
Just real quick, most of you know the NAACP is celebrating its 100th anniversary of dealing with social and civil rights issues. And I recently came back from the National Convention in New York City, and there were several resolutions that were passed. And in particular, there's some ones that are dealing with the health issues. What we would like to do is take these resolutions that are on a national level and particularly target how it affects West Virginia. Because what we do with our resolution process is send them to people like Senator Foster and the governor to get them enacted into law. And there's no sense in just speaking words if we can't have action behind it. So the particular issues that NAACP will address will come out of our state conference which will be held in 2 weeks at West Virginia State University on the 7th and 8th of August. So we ask that, you or and the public are invited. There's only like an hour business session that's closed, and the delegates will take part of. But the forums that will be held are open to the public, so do come out and join us. Thank you.
So we thank you for coming, and that ends the press conference. If you have questions for any of us, feel free to ask them.